Hello, Taylor's University students. My name is Li-Mei Chen. I am a professor at Yokohama City University, Graduate School of Cultural and Social Urban Studies. Today, I would like to give you a lecture about Japan's social welfare issues. Let me share you the PowerPoint screen. The lecture will consist of four parts. First, I would like to talk about the demographics of a super-aging society, present and the future. Part two, what are the problems and issues of demographic aging on Japanese society? Part three, reasons for making the problems worse. Part four, Japan's welfare state, focusing on long-term care system. So let me begin with part one, demographics of a super aging society, present and the future. So Japan is the first country in the world to reach a super aging society. In 2022, Japan's total population was 125.5 million persons. In comparison, Malaysia's total population is 32.7 million persons. Out of the total population, persons 65 plus were 36.27 million persons, which comprise 29.1% of the total population. In Malaysia, you have 3.6 million persons aged 65 and older, which is only 7.3% of the total population. So Japan is about 3 times more aging than Malaysia. This population aging has started right around the 1970s. After World War II in 1945, Japan was steadily aging its population. If you can see from the chart on your right, from 1950 to 2060, you can see that the population has steadily grown, and with it, population aging. In 1970, it was about 7.1% of the population was 65 years and older, which is approximately what Malaysia is today. By 1995, it was 14.6. At this time, people call Japan aging society. By 2010, Japan reached 23%. At this point, Japan became a super aging society. Population aging is predicted to increase over the years, and by 2060, 39.9% of older adults, of the population will be older adults in Japan. So what are the characteristics of population aging? Number one, increasing oldest old population. The largest aging population is the baby boomer generation, or which we call Dankai no Sedai, who were born between 1947 and 1949. They turned 65 years and older in 2015. There were 33 million of them. This population will turn 75 years old in 2025, and there will be 36 million of them. That age group, or that cohort, will continue and peak and will be in 2042, when 39 million will be older adults. After that, the population between 65 and 74 is predicted to decline. Because of the Dankai no Sedai population aging, the oldest old population is increasing. Today, 28.72 million of older adults are 70 plus, which means 1 in every 5 persons in Japan are 70 years and older. There are also 12.35 million who are above 80 years old. Which is more surprising is that there were approximately 90,000 people who are 100 years and older, up 4,016 from the previous year. So this is the chart which shows how persons who are 100 and above have grown. This population in particular has grown in the past 52 years. So right after World War II, this population has been steadily growing. Next, there has been an increase in older adult couple or living alone households. The picture you see on the right is a comic in Japan called Sazae-san. A Sazae-san is a household with three generations living under one roof. However, this kind of three-generation households has been declining over the years. In 2019, 49.4% of all households had a family member who was 65 years and older. In 1980, 50.1% of all households lived in a three-generation household like Sazae-san's family. But by 2019, only 9.4% lived in a three-generation household. Instead of these multi-family households, more older adults are living alone or living only by couples. In 1980, only 4.3% of men and 11.2% of women lived alone in 1980. But by 2015, 13.3% of men and 21.1% of women lived alone. By 2030, 37.7%, or 1 in every 7 households, will be older adults living alone by 2030. Here is the chart of the household types with family members who is 65 years and older, and the rate of households with older adults 65 plus. As you can see, it has been increasing over the years. Next, there has been a rapid increase of population aging in cities. Japan overall is population aging, has been experiencing population aging, but these the population aging has also been experienced, especially in the metropolitan areas. Among 47 prefectures, Tokyo, Kanagawa, Chiba, Saitama, Aichi, and Osaka prefectures, which have major metropolises, have experienced the most rapid increase of population aging. The other characteristics of superaging society is higher death rates. In 1960, there were about 700,000 deaths, and in 2021, there has been 1.4 million deaths. The reason for dying, the top reason is cancer with 26.5% of deaths, followed by heart disease, 14.9%, and aging-related issues, 10.6%. This death rate is supposed to increase along with the aging society, which will lead to a natural decline of the population. The population is thought to decrease under 100 million. By 2053, the population will be 99 million, and by 2065, 88 million persons. This is approximately the same population with Sweden. Here is the chart of the birth rate and death rate. The death rate is the green line, and the birth rate is the red line. You can see that there is a decline in the birth rate and an increase in the death rate. The pink bar is the actual number of births, and the blue bar is the actual number of deaths. Next, I would like to talk about what are the problems and issues of demographic aging on Japanese society. In part one, I've talked about different demographics and statistics of current Japan's population. Now, what does this demographic aging result in society? In Japan, almost every day in the news, we hear something or learn about something related to aging society. For example, on the top left, it talks about the increase of health insurance because more and more older adults are using the health services. The health insurance beneficiaries have to pay a higher premium. On the right-hand side, it talks about how older adults have to prepare for their retirement. And for a couple, they would need at least 10 million yen for their retirement because they're living longer and will require more money. And the lower left, it talks about lonely deaths. And lonely deaths has become a major problem for many people, even around us, where approximately 40% of lonely deaths are by adults. So the declining birth rate in working age population has been ongoing in Japan. Birth rate has been declining, and by 2065, there will be only 560,000 births per year. It is predicted that the population between 0 to 14 years old will be under 10 million in 2056, and by 2065, it will reach 8.9 million, which is half of today's current population of 0 to 14 years old. The declining birth rate will definitely affect the number of working age population. In 2029, the number will be under 70 million persons, and by 2065, it will be 45 million persons. What this also means is growing social security expenditures. Since there are not a lot of people who are in the working age, not a lot of people will be paying into the National Social Security program. So overall, Japan has been experiencing sluggish GDP growth since 1990. So the public social expenditure to GDP ratio has increased because of it from 11.4% to 16.6% in 2005. The economy is doing bad, but we have an aging population that is using health services. And also because of the economic decline, there are a lot of people who have less income and require social welfare. So, but if you look at the OECD data on public spending on family benefits and cash services and tax measures and percentage of GDP, Japan is quite low compared to other countries. If you can see on this chart, countries like Denmark and Sweden and Finland and Norway, which are Scandinavian countries, actually spend more money in terms of GDP compared to a country like Japan. Japan is much similar in its spending to countries like Chile and Switzerland, Greece, United States, and Mexico. It is far below the OECD average too. So we talk about how the public spending has been increasing over the years. But if you look from a global perspective, Japan has not been spending much compared to other countries. The other issue related to this demographic aging, which has become a huge social problem, is that older adults have been increasingly dying alone, and they are called lonely deaths. In 2021, there were 4,448 lonely deaths in Japan. The average age at the time of death was 61.6 years old. 60% were 60 years and older, but if you can see from the average age, it's not as old as we think they are. Because the average longevity age in Japan for men and women are in their 80s. So it means they have died really prematurely. 83.1% of these lonely deaths were men. So people who die alone are more likely to be men than women. On a separate statistics, older adults comprise about 3/3 of all suicides, the reasons being health issues. The suicide rate among older adults have declined over the years, while those who are in the 20s and 50s have increased. Suicide is higher in prefectures with major metropolis such as Tokyo, Osaka, Kanagawa, Aichi, and Fukuoka. So we saw the different social problems resulting from demographic aging, but what is making this more of a major problem? First, the speed of population aging. Japan did not have enough time to prepare for a super aging society. Here is a chart showing a international comparison amongst countries that are experiencing population aging. If you can see that the years required for population aging, 14 to 21%, and years required for population aging, 7 to 14%, Japan has really had a very short period of time to prepare, while countries like the UK or Sweden or France had more time to prepare for their aging population. So as a result, Japan was not really prepared for its aging society. The other reason is the economic decline of Japan. Since the 1990s, Japan has been experiencing economic decline. We say the last 20 years in Japan. And this has definitely impacted older adults. 64.6% of older adults are supposedly not worried about their financial situation, especially those over 80 years old. But for 68% of all households, public pension makes up about 80% or more of the total income. But this public pension is not sufficient for older adults in many cases. If you can see, the public pensions in Japan are projected to provide the second lowest pensions relative to individual earnings of OECD countries. The replacement rate for average earners in Japan are 33%, while the average for OECD countries was 59%. Replacement rate for lower earners were 47%, while the average for OECD countries was 71.9%. Therefore, although many people, as we saw in the earlier slide, that not a lot of old people are worried about their financial situation, especially amongst the oldest old, many people don't have a sufficient replacement rate for their daily living. So what Japanese people do is that they save a lot of money, try to save a lot of money. Why they save? They say in the event that something goes wrong, 47.5%, followed by to sustain the daily lifestyle. The median savings for household of 60 plus was 50 million yen, and the entire household was 10 million yen, a 1.5 difference. So as the older you get, the more people are trying to save. So a lot of older adults in Japan are feeling a crunch. They don't have enough money, retirement money expected from the national pension. So they have to continuously save. And how do they save? They receive money from working. A lot of older people work in Japan. This has led to the rising poverty of Japan. Japan's poverty rate was 15.7% in 2018. This means that 1 in 6 Japanese people are living in relative poverty. Japan's poverty rate was the 4th highest among the 30 OECD countries after Chile, Mexico, Latvia, and Romania. Especially what is startling is that child poverty rate for children was very high, 16.3%. But comparatively speaking, the poverty rate among the older adults were high, especially for people over 75 plus. Because of people who have who are living on very low income, adults going on welfare has risen. In 2019, there were 16.3 million persons on welfare, up 1,919 persons increase from the previous year. The percentage of older adults on welfare was 55.1% of the total number of people on welfare. So as I said earlier, more older adults are working in Japan. The entire working population was 66 million in 2016. Older adults who are working are increasing in every age group, especially among 70 plus. Approximately half of these working older adults work in forestry and agriculture, followed by real estate and rental businesses and other services. Japan has one of the highest working older adult population among OECD nations. And Japan, because of this declining population, Japan has re-evaluated its working policies. And for example, Japan has created the law concerning stabilization of employment of older persons, which try to get rid of the mandatory retirement before 60 years old. Retirement age has been moved to 65 or older in Japan. In addition to moving the retirement age, benefits would also be provided for those who have worked. There are also like re-employment training programs for older adults, and government grants have been created for older adults who want to do a startup business. But the issue about older adults working is that older adults are working, but they are working in low-skilled, low-paid jobs. In 2020, older adults who are working non-full-time work are more than 76.5%. This means that they are working in part-time or contractual basis. Most of the jobs for older adults remain low-skilled labor, like building guards, cleaning attendants, storage keepers. Despite, for example, the Dankai no Sedai, who are 75 plus cohort group, they are more educated and highly skilled, but the work that are available to them remain low-skilled labor. This is a big difference from countries like in the West, like US and Europe. Unfortunately, older adults' crime rate is increasing. Older adults' crime rate has been on the rise since 2010. 17% of all crimes were convicted by older adults. Men and women are growing at an equal rate. Among the crimes, nearly half, about 48.7%, were petty thefts. In the right-hand side, I have delineated some of the examples of their older adults' crime. Let me read you each one. First of all, the first offense, 65-year-old who worked at the same company for 40 years and retired, currently at a new job and has no financial problems and family problems. He has 2 children and a wife. But he touched a woman's lower body in the subway and was fined 300,000 yen. Another person has previous record of offense. 67-year-old woman who lived with her husband. She lost her wallet at a nearby supermarket and stole daily items to recover her loss. That triggered her to steal again and was caught twice. Stole food, etc., and was fined 300,000 yen. The third case, this person also has previous record. A 69-year-old male. He has been caught drinking and driving. After retiring, his wife passed away and he lived on a pension alone. Because he was lonely, he would go out and drink. On his way back home from drinking, a subway staff scolded his behavior. He got angry and punched him. 150,000 yen fine. So as you can see from these cases, usually they don't have a really serious problem, but they're usually very lonely or isolated. Have been engaged in these offenses. The other problem that we see is the growing long-term care needs. As the population is aging, there are health declines, and there is a need for people to receive support in their daily lives, such as eating or toileting or dressing or go shopping and things like that. And in Japan, we have the National Long-Term Care Insurance Program, which was established in April 2000. And since then, as you can see, the expenditures for the long-term care insurance program has been on a steady increase. If you see on the very bottom, the boxes, in the year 2000, when the long-term care insurance program started, the long-term care insurance program premium was 2,911 yen. Currently, in 2015 to 2017, the long-term care insurance program premium has nearly doubled. So let's look at the statistics. In 2021, there were 35.83 million people, 65 years and older, who were beneficiaries. In order to use the long-term care services, they would need to be certified. So those who were certified for long-term care was 6.8 million. 2 million were men and about 4 million were women. Older people can receive care in different places. Those receiving care at home was 3.9 million persons, and in the community-based services was 860,000 persons. those receiving care in the facility was 950,000 persons. So as you can see, most people who are eligible for long-term care services receive services at their homes. On a related note, there is also a growing population with dementia. In 2025, it is predicted that 1 out of every 5 older adults will have dementia. By 2040, 1 out of every 4 will have dementia. And by 2060, 1 out of every 3 will be having dementia. So with the increase of the aging population, the number of people with dementia will also increase. This is a kind of a chart, which is very similar to one I showed earlier, that Japan's social expenditures are not that high compared to other countries. It is lower than the OECD average, but a bit higher than the United States, and far less than countries like Sweden, France, and Austria. I think I mentioned about this already, but the financial situation in Japan isn't great to this day. Although Japan is the world's 5th largest economy after China, the EU, US, and India, it has not been growing much. And this has been a steady decline since January 1990. And in 2008, with the Li-Mei shock, the financial crisis even hit harder. And currently, the standard of living is lower than the US or the EU. But I have to correct that probably the living standard is lower than the current China and South Korea. Because of all these reasons, when you ask the Japanese people what do they think about their future, approximately 60% of the Japanese think the future is not bright compared to today. So many Japanese people are very pessimistic about the future. Given that, I would like to talk about Japan's welfare state, focusing on the long-term care system. So let me tell you a little bit more about Japan's social welfare state. Today's Japan's welfare state was created post-World War II. The GHQ, led by MacArthur, i.e. the US occupation, had a major influence on the development of Japan's national constitution, the social security system. After World War II, Japan was in shreds and was experiencing high numbers of poverty rate. There was also a lot of chaos since it was right after the war. So what the U.S. occupation did was to stabilize the national life and secure social order. There was a need to revamp its foundation for social security too. So what the U.S. occupation did was to create a state's responsibility in provision and improvement of people's welfare, make it non-discriminatory and provide equality. And in the Japanese constitution, it established a social right to a minimum standard of living and changed the way the role of the state was understood previous to the war. It guaranteed a minimum standard of living. The public assistance law, or what we call the social welfare system, was created in 1946, followed by child welfare law in 1947, and the welfare for physically disabled persons in 1949. These were created one after the other because these were the population that had, that were having the most hardship after World War II. Oh, so this is a picture of MacArthur. So when we talk about the social security system in Japan, we are referring to the 7 areas as delineated here. So the first is the public pension program, which gives money to people at their old age or if they have any disabilities. The second part is the health services and health insurance program. Japan has a national health insurance program, which is divided by the type of professions they have. If a person who works for a company will have a company-based health insurance program, while those who are self-employed have a separate program. And there is also a separate health services for the elderly for 75 years and older, which is created in the 2000s, where older people have their own program. Thirdly, the personal social services for the elderly and persons with disabilities. I mentioned about the long-term care insurance program, which was created in April 2000. And there is also support for independent living of persons with disabilities, which encompasses young small kids to older adults. Fourth, the unemployment insurance and related policies. So there are unemployment benefits for those who are out of work or unemployed. There's also the labor accident insurance. If you have any major health problems or accidents during work or going to and fro work, the labor accident insurance will cover that. And the family policies. In Japan, we have child allowances, maternity leave allowances, and daycare services for children. But usually these are run by the local municipalities, and they are determined by needs. So it's a means-tested program. So although those with low income are more eligible in many cases to receive these allowances. And last but not least, the public assistance program, which is the last safety net. In English, we would call it welfare. So this is a slide kind of distinguishing the meaning of Social Security in other countries, because in the United States, when you say Social Security, it's usually only about pensions. But in Japan, Social Security will encompass all the 7 different domains that we saw earlier. A social welfare researcher, Furukawa, called Japan's social welfare system as an L-shaped structure. It encompasses the following parts. Social welfare is part of the social policy, but is also very much related to the economic policy and national security and safety policy. But in addition to what we call all the different benefits in the social insurance program, we do have the protection of rights and also like consumer protection, the courts, housing. All those other domains are also included in the social welfare policies in Japan. And because of the post-World War II establishment of the Social Security system, and thanks to growing economy after World War II, Japan has experienced growing life expectancy. Today, the average is 83.7 years old, which is also one of the highest in the world, which is followed by countries like Switzerland, Singapore, Australia, and Spain, but it really tops it off in the world. The other index, which is the healthy life expectancy, which refers to the number of years people live in full health. Japan is also leading. A lot of older adults live up to 40, live in a healthy stage till 74.9 years old, followed by Singapore 73.9 years and South Korea 73.2 years. So approximately, Japanese older adults who require long-term care insurance program is usually like approximately 10 years in their late life. I mentioned earlier that Japan doesn't spend a lot, publicly on social spending, but that also extends to the health services. Japan does not spend a lot of money compared to a country like United States. But Japan has managed to increase its health longevity despite low expenditures. So what we can say about Japan's situation is that just spending a lot of money on health doesn't equate to increasing longevity and health status. Then here I would like to talk about Japan's long-term care insurance program. So prior to the long-term care insurance program, after World War II, Japan has been creating different laws regarding social welfare. We saw earlier that Japan created, for example, the public assistance law, the child welfare law, and the law for persons with disabilities. For the older adults, it was 1963 when the elderly welfare law was issued. In 1960s, Japan was already experiencing an economic boom, and the population aging was only 5.7%. And this kind of, with the, economic boom, Japan was experiencing a very kind of optimistic view of providing for their people on a national level. In 1970s, Japan's economic boom is peaking, but the government set to free medical care for older adults in 1973. But at the same time, as I said, it has already peaked around at that time. And with the free medical care and the increasing aging population, it led to an increase in medical expenditures for older adults. A lot of people started to talk about this financial strain on the health insurance program as the problems by the elderly. At this time, population aging was 7.1%. In 1980s, population aging was 9.1%. The medical expenditures has been steadily growing, and they figured out that the older adults, the free medical care has to be terminated by then. So in 1982, free medical care for older adults were terminated under the Law of Health and Medical Services for the Elderly. The older adults were placed in a separate health insurance program of their own and had to pay in to their own program from their own premiums. And by 1989, health services were not only in demand, but also long-term care services. In 1989, the GOAL plan was established to meet the long-term care needs of the older adults, because there has been a growing phenomenon of social hospitalization and bedridden older adults who were filling up the hospital beds. And by this time, it was called the problems of the aging society, because it was not only, older adults were not only the ones to be blamed, but the ill preparation of the society to meet the demands of the aging society. So what Japan did was to create a program that would sort of meet the needs of older adults who were low income or have no family, which was traditionally taken care under the social welfare system, and also the medical and health services, which was created under the National Health Insurance Program. We needed a program that kind of served these populations and also those in between. So what happened was a new goal plan was created in the late 1990s. I'm sorry, a typo, it's 1993, which promoted home long-term care. The long-term care insurance law was issued in 1997, but it took another 3 years because of lack of financial lack of finances lack of finances to support the program. So it took 3 years to start it. So in April 2000, the long-term care insurance program was implemented, and every 5 years, it would revise the law to meet the different needs of the growing aging population. So to sum up, the long-term care insurance program was to socialize long-term care, so it was no longer a family burden. Increasingly in Japan, women were going out and working in the workforce, and they could no longer take care of the family. So long-term care insurance program was very much needed to liberate women from the role of family caregiving. Also, as I mentioned earlier, there were 2 separate systems, the social welfare system and the medical and health services system. They needed something in between, which was based on an insurance system. So the benefit and the burden will be much clearer compared to a tax-based system. So the long-term care insurance program was created. It also opened up doors for private companies to provide long-term care services. Prior to the long-term care insurance program, long-term care services were only provided by those who had contracts with the local governments. But now the private industry were also able to provide services. This was a choice that the Japanese government made to create competition, a healthy competition, where prices will be kept lower and the quality of services going up. And here is the sort of the overall picture of what the long-term care insurance program looks like. If you can see on the very bottom, the service users are divided into 2 groups. People pay into the long-term care insurance program premiums starting from age 40. So people from 40 to 64 years old create the category 2 insured group. And the category 1 insured group are people ages 65 and older who are actually probably the most likely to use the services. So these people pay the premiums to the program. And let's say an older adult who needs services, they would contact their local municipality and be certified for eligibility. And then once they're certified, they will be able to use the different services, which is on your right-hand side. Again, this is the chart that talks about the 2 insured groups, the 40 to 64-year-old and the 65 and plus years old. For the eligibility requirements for the use of long-term care services, for those who are 40 to 64, they must have a specific disease, an aging-related disease such as rheumatoid arthritis or terminal cancer to be able to use long-term care services. But for those who are 65 and older, regardless of what diagnosis they have, if they need long-term care services, they will be eligible based on their certification level from 1 to 5. How do they pay into the insurance premiums? For the younger group, they're withdrawn from the health insurance premium, and from the 65 and older group, they are withdrawn from the pension funds. So this is the sort of the relationship between the service provider, the beneficiary, and the insurer. And as I said earlier, the private industry has been able to provide long-term care services under the long-term care insurance program. So the designated service provider and the long-term care insurance beneficiary will have a direct service contract between each other. The long-term care insurance beneficiary will pay 10% of the services, and the remaining 90% will come from the insurer, which is the local municipal government. The long-term care insurance revenue source, half of it will come from the insurance premiums of the beneficiaries, and the other half is split up by the national government, the prefectural government, and the local government. So let me kind of take you through the process of how one applies for long-term care services. This is an example. Let's say a grandma who's 75 has rheumatoid arthritis and she needs some assistance in her daily life. To be eligible, this grandma needs to apply for long-term care at her local municipality office, but she doesn't have to go in person. For example, her family members or her neighbor can go and make the application. So in this picture, her son is making the application. Once the application is in, there will be a visitation from the local municipality government. Grandma will receive an assessment on the following items. These are the items, and if you can look through them, they're usually related to daily activities, more of the physical and cognitive functioning of the older adults. So it doesn't necessarily look at, let's say, whether you have family members who will provide help with long-term care needs, for example. That is not will not be a concern in order to receive long-term care services. It's only used based on the physical and cognitive functioning of the older adult. In addition to the assessment, there's a doctor's recommendation that has to be submitted. So grandma's doctor will provide a letter of opinion on her health and reasons for requiring long-term care services. It's usually the primary doctor who looks after this person, this individual, over the years. So he or she has a very good understanding of the older adult's conditions. Based on the visit, on the assessment, and the letter from the doctor, a formal eligibility committee looks through these paperwork. They meet every month to make a decision on the level of care needed based on the assessment, doctor's letter, and the notes. The initial care level eligibility is good for 6 months, and renewal is good up to 2 years. So the person who requires preventive care is usually what we see in this chart, the support level. Support level is divided into 1 and 2. And the insurance pays about 25 to 31 minutes or 32 to 50 minutes of care. These can be, as I said earlier, like health promotion, health activity programs, rehabilitation programs. The actual long-term care services, which require more personal care, is from care level 2 to care level 5. Usually the older adults who have a higher care burden is from care level 3. People who are admitted to long-term care facilities are from 3 and above. And in 2016, most of the care is still done by informal caregivers. More than 60.3% are families who live with the older adult. And women provide much of the care. Amongst the women, 26.8% were female spouses, which make up the largest group, followed by 21.8% and 11.2% who are wife of the child. When you look at the age, 69% of male caregivers and 68.5% of the female caregivers are over 60 years old. So what we see in Japan is that older people are caring for older people in Japan. In sum, Japan is a super aging society. In particular, the oldest old population is growing at a faster rate. With population aging, the traditional structure of families and neighbors supporting people's well-being has deteriorated. More people are living alone and are feeling lonely and isolated. This is not only the phenomenon among older adults, but also among young people. Social problems among older adults include poverty, unmet long-term care needs, lonely deaths, and crimes. Today's Social Security system was created after World War II under the U.S. occupation period. And finally, the long-term care insurance program was created in April 2000, which socialized long-term care. Although it was to free women from caregiving role, the majority of caregivers are women to this day. Thank you very much for listening to my lecture, and if you should have any questions, please send it to me.